patients ignore that later lead to serious heart or health issues?
First of all, can you all hear me?
Yeah.
First of all, I'd like to say good afternoon and thank you so much for inviting me. This is a wonderful, wonderful forum in which we can really do a great exchange of information, and I appreciate being included. There are many times, as you said, we don't look at ourselves. We look outward and give to everyone else. We have to understand how to look at ourselves and how to do a good self-assessment. Your instinct also tells you, like your husband, when something's wrong, something is wrong. So really trust your intuition. Some of the early signs and early things that we tend to ignore are obviously chest pressure. You're feeling pressure, whether it radiates into the arm, into the face, then that's a warning sign. Sudden shortness of breath. You can't catch your breath, you don't know why, especially after exertion. That's another warning sign that should signal you, I could walk X amount of blocks, last week, and now I cannot. That should signal you that something is wrong. Any sort of facial drooping, facial asymmetry, weakness in an arm, arm or leg, and you just don't feel, your face is drooping, and you just don't feel strength. That can be signs of a stroke. Any sort of gastrointestinal problems, sudden abdominal pain. In women, sometimes things don't present typically, as they do in men, especially heart disease. Sometimes in women, it presents as symptoms of reflux, GERD, things like that, and that might be signs that something's going on with the heart. Any sudden sort of headache, a very severe headache, worst headache of my life, should signal you, listen, this is not just a regular tension headache, maybe I need to go, to the hospital, maybe I need to go to the ER, something could be wrong. Any sort of changes in vision, especially if it's a loss of vision that's very quick and then all of a sudden it comes back. Could be a sign that, because our vision, the nerves are connected to our neurologic system, and so that could signal that something is wrong. So those are things that we should not ignore. Sudden fatigue, tiredness, sweating should also give us a mind that something's going on with my heart. All of a sudden having all these allergic symptoms, I need to get this checked out. Many times we don't. And for women, any bleeding after menopause, that's not normal. You're no longer in childbearing age. Any bleeding after menopause should be a sign that I need to go and check this out. Breast pain, discharge from the nipple, bloody discharge, or any sort of discharge from the nipple, especially in women as we age, that should be a sign as well. Getting your screening test, doing your prevention, getting your screening test in a timely fashion, doing your mammograms every year, doing your colonoscopies as indicated, your Cologuards, which your doctor can have sent to your house. Those are all key things. Men having your prostates checked, women having your bone density test. All these things are preventive. And we really need to be on top of proactive. We have to be proactive instead of being reactive. And that's the thing. Prevention is better. Ounce of prevention is worth a pound of cure. So preventing these issues and being aware. But when our bodies tell us something is wrong, don't let anyone talk you out of, oh no, it's probably just this, or probably just this. Check it out because you are your own best advocate.
Thank you so much, Dr. Maria. Next question.